Thank all of the participants that have joined us tonight. Speak to the community in ways that will help them to understand our concerns and our goals to save lives. Thank you, Cheryl.
So next on my screen, we have Dr. Yolanda Lewis-Ragland. You have the mic. Please unmute your mic.
Oh, thank you so much for having me. My name again is Dr. Yolanda Lewis-Ragland. I am a pediatrician. I work here right in the nation's capital in Washington, D.C. And I'm just delighted to be here and be a part of this very important conversation, a very important project in terms of getting this information out into the ethos.
Agreed, 1000%. Thank you, Dr. Lewis-Ragland. Next, we have Dr. Jihan, affectionately known as Dr. Gigi El Bayoumi. Dr. Gigi, you have the mic.
Oh, thank you. Thank you. Well, first of all, it's a pleasure to be part of this wonderful group. I am the founding director of the Rodham Institute here in DC, which is dedicated to improving health equity in the nation's capital, which has actually a lot of the highest disparities in the country per capita. I'm just going to give you one. I'm a physician and a professor of medicine at George Washington University. So the only statistic I'm going to give you is that if you live in the richest part of town, you can expect to live 94 years. If you live in the poorest part of town, 66 and a half years. So that's almost a 27-year difference in a 10-mile span. And that is shameful in the nation's capital. But as you will hear from my colleagues from DC, we're part of the action team to make a difference. Thank you.
Thank you so much, Dr. Gigi. And thank you for bringing some of your colleagues to this space. Up next on my screen, I see Dr. Keith Crawford. You have the mic, Dr. Crawford.
So first of all, thank you for inviting me. As you can see, DC is in the house tonight, so we are representing well. I am a clinical pharmacologist with specialization in chronic infectious diseases like HIV disease, tuberculosis, viral hepatitis. I work at the National Institutes of Health in the Division of AIDS. And I just want to say before any discussion that any comments I make are my own personal, professional opinion based on fact. They're not the official statement of the National Institutes of Health. I have focused a lot on clinical trials, particularly in resource-limited settings, and done a lot of clinical work with HIV and TB and malaria in Africa in the motherland. So that'll be my introduction. Thank you.
Thank you, Dr. Crawford. Next on my screen, Dr. Erica Deadly. Thank you for joining us.
Good evening, everyone. My name is Dr. Erica Dudley. I'm a psychiatrist and I work for the federal government, and I'm located in Broward County, Florida.
Thank you, Dr. Dudley. I see a lot of repeat, I won't say offenders, complimenters on the screen. I'm really grateful for all of you. And I don't know if you heard me earlier, but I appreciate you, Minister Patrick Tyson. Thank you for streaming us on Gospel Showcase Live out of New York and Mount Vernon. We really appreciate you. Next up on my screen is, let's see, we have I exhausted all physicians? In case I miss you, you may want to speak up now or forever hold your peace.
Dr. I speak up. My social media handle is Dr. Yola, Ask Dr. Yola. My full good government name is Dr. Yolanda Hancock. You guys will struggle through it. It's okay. It won't be the first time that Dr. Yolanda and Dr. Yolanda have shown up in these spaces. Not only are we colleagues as pediatricians, we are also sorors in Delta Sigma Theta Sorority Incorporated. I wear several different hats, one as a pediatrician, two as Dr. Lewis-Ragland downplayed all the greatness that she is also an obesity specialist, as am I. And the other hat that I wear, other than being a mother and that being my most important hat, is doing a lot of work in the public health space, both in teaching the next generation of public health professionals, but also in one, incorporating public health in practice, and two, doing it in the community, whether it be having COVID-19 community conversations or showing up at a rally or a protest to make sure that our lives matter. And I just appreciate the space that I have been invited into. Thank you.
Thank you for joining this space, Dr. Yola.
Pardon me, Dr. Gracia, would you mind introducing yourself?
Sure. My name is Dr. Deborah Gracia. I'm located in Miami, Florida. I'm the Chief Medical Officer at a community health center. I'm an internal medicine physician and also integrative medicine physician. And thank you for having me in this panel. It's my pleasure to serve the community.
Thank you all, esteemed physicians, panelists, for being here. I think this is a very necessary conversation we're having together tonight. So we have quite a few questions. I think we have about 30 or so, team, am I correct? And that being the case, what I'm going to do is right on into the questions, but I'll ask that as you, my screen just froze, hopefully you can still hear me. I'll ask that in answering the question that you're mindful of the time so we can cover as many questions as possible. If you have a question for our panel but did not submit it with your registration, it may be covered, but please drop it in the chat and we'll do our best to work it into the answer this evening. So Amelia, I'm not Amelia, but Kiana, if you will, perfect, she's so on it. Question. Perfect. So will the current vaccines and or booster shots be effective against the Lambda, and pardon any mispronunciations, Mu or Mu variants? Anyone can jump in.
So, and it's Mu, it's the Mu variant, the Lambda and the Mu variant. I think if it might be important if we understand, we talk just a little bit about what the variants are. What do we mean when we say mutants and variants? I think that's important. May I do that, please? Okay, so first of all, I want you to try to visualize this virus, the coronavirus. The way I think about it is that this virus looks like a soccer ball with spikes. So think of a soccer ball with spikes sticking out of it. That's kind of what this virus looks like if you look under a very high power microscope. That spike, or those spikes, are called the spike protein. So what is a mutation? A mutation is the change or a change in the genetic code for a protein. Proteins are made from a genetic code. And so a mutation is a change in that code. And a change in that code could lead to a change in the protein. The spike protein is very important to the virus. Two main reasons. The virus uses that spike to latch onto our cells. That's how we get infected. So the spike protein gets the virus into the cells. So a change in that structure could make the virus more infectious because it gets into our cells easier. The spike is also what our immune system recognizes. So when our immune system launches an attack against this virus, it's launching an attack against the spike protein. So if the virus can change the structure of its protein, it may be able to trick our immune system and escape from the immune pressure. So a lot of these variants that we have changes or mutations in the spike protein. That makes them more infectious, that makes them spread easier. It also makes them escape our immune system. So when we talk specifically about the Mu variant and we talk about the Lambda variant, essentially all of the variants do not respond or are not attacked by the immune system to the same degree as some of the earlier variants. So we compare them to, if you think of the variant we had last year, which is referred to as the 614G, D614G variant. Okay, that was the most common one. we compare these more recent variants to that one. And in that case, the antibodies that we produce, either in response to an infection or a vaccination, do not control the variants as effectively. Our antibodies are weaker against these variants, and that is the case for both the mu and the lambda. Now, important caveat, that does not mean that we cannot still protect ourselves from the vaccines. Because even though the level of protection may not be the same, protection is still there. So if we think of the Delta variant, and the Delta variant is the leading variant. It's the leading variant because it reproduces better than mu. It reproduces better than lambda. So even though lambda and mu have some advantages, they cannot compete with Delta. And so even when these other variants pop up, Delta can outcompete them because it produces so much more virus. And what we know is that the antibodies from the vaccinations, from a 2 vaccination, they're weaker against Delta, but they still work. Most people still have enough antibody to protect themselves. Some people lose antibody protection over time, and some people may have medical conditions where they never produced enough antibodies in response to the vaccine. So those people could get a breakthrough infection, and giving a booster shot could give them additional protection. But everybody may not need a booster shot. And I hope that answers the question. I welcome, any of my colleagues to chime in and give their perspective on it.
I think you covered it perfectly. So if we can move on to the next question, just because we have so many, I want to try to cover as many topics as possible. Would that be okay with all of the panelists? Okay, so the second question, if you want to share the screen here, and we can show the second question, or I'll pull them up on my end as well. Okay, so this question comes from Carol, and I think that it may have already been answered, but let's, how long will the third vaccine, meaning the booster shot, be effective? Anyone can jump in on that one.
I think I'll take that question because I think it's important to kind of go through a concept. So it must feel very confusing to the public to get what seems like contradictory information. So I'm going to give you an analogy. I hope that this works. The last hurricane that we had was a developing story, right? We had to stay tuned for updates. So we don't know which way the hurricane is headed. We also know that when you go into a shelter and evacuate from your home, that's the safest place. That's at 100% protection. So I think it's important for people to realize we're not presenting contradicting information, just the most up-to-date information. So the question is an excellent one. We're not sure. However, given our knowledge of hepatitis vaccines, it seems that we will be better protected with 3 doses. I don't think that we should think of it as a booster, but rather as a series that has protected us. But stay tuned, trying to do our best in getting the best information. And I should put a disclaimer, all the information that you're going to hear from the panelists is the most up-to-date information that we have now. That doesn't mean that it can't change. And I think where sometimes it can feel confusing. Thanks.
Thank you, Dr. Gigi. This question comes from Fawn, And her question is, how are we deeming the vaccine safe when long-term effects are yet to be determined? Anyone can take that one.
I'll jump in real quick because I just answered this question at a talk that I gave earlier today. One of the things that we have to recognize is since we stopped using live virus vaccines, we have not seen any evidence of what people have classified as long-term effects from vaccines. There have been false claims that vaccines are associated with things like autism. Over 1 million children have now been studied, and there has not been any evidence-based valid study that shows a link between autism and vaccines. The person who actually created the first study, Dr. Andrew Wakefield, lost his license. The publication was removed from circulation, but the horse was already out of the barn. And as a pediatrician, this is a question that we get asked often in terms of long-term implications of vaccinations. When it comes to vaccines, and anyone can pull up any of the data, you go to the CDC, any data sources will show you that since we stopped using live polio vaccine, which was facilitating some polio cases, since we transitioned, we have not seen any long-term associations. What we see, especially when it comes to adverse outcomes, and I think it's important to differentiate in terms of language, side effects are the things you're expecting to get when you get a shot or take a medication, right? You take Benadryl, you expect to get a little drowsy. It's not a surprise. When you take a vaccine, it's not surprising that your arm's going to be a little bit sore. It may be red, it may be tender, you may have a little bit of fever, you may even have some lymph nodes swollen underneath your arm. That lets you know your body's doing what it's supposed to do. Then you have what are called adverse outcomes, things like Guillain-Barré, an autoimmune attack on the nervous system, Bell's palsy, an autoimmune attack on the facial nerve causing temporary facial paralysis, or myocarditis, something that we've seen in the younger population. All of those things happen within days to weeks of receiving the vaccine. We do not see years out, oh, this was linked to X vaccine. The longest period of time that was passed where we saw a side effect or an adverse outcome associated with a vaccine was something called the rotavirus vaccine. It protects babies against really bad diarrhea. So we were giving babies this vaccine to protect them from having to be in the hospital, mommies and daddies from having to lose work, and occasionally them dying from really bad diarrhea. 6 months out from getting the vaccine, we started observing something called intussusception. It's when the intestines telescope on each other. So it's sort of like it goes inside out. Your intestines go inside out. Well, when the FDA started tracking this and pediatricians transparently were reporting it out, 6 months after the babies got the dose, it was like, pull it off the market. It was pulled off the market immediately, redesigned, reintroduced. We have not seen any of those issues since then. So one, I tell that story for two reasons. One, because that's the longest length of time that I, in my almost 20 years of being a pediatrician, have seen an adverse outcome come after a child has received a vaccine. And two, it shows that the FDA was on its job, and we as healthcare professionals were on our jobs in terms of reporting it out. And we see the same thing with the adverse outcomes through either the vaccine adverse event reporting system that healthcare professionals report to, or through the vSafe app, which we as a community report to. I mean, when my eye twitched after I got my vaccine in April, I reported it. I was like, I got an eye twitch. I don't know what that means, but I'm gonna report it out just in case 50,000 other people also get eye twitches. The system works. It lets us know what's happening. And when the vaccine is in the body, it's booted out after several days. It's not like it hangs out for weeks, months, or years. To be honest with you, I tell people we need to pay closer attention to what we're eating than what we're doing in terms of this vaccine. That Popeye's chicken sandwich that you get every Friday, right? If we're really honest with each other, that order of McDonald's French fries you sneak in after you work out every Saturday is what's going to do you in terms of long-term complications. We see food additives, dyes, flavorings that facilitate a lot of pediatric health issues that aren't part of these conversations. Instead, the vaccine is. And I think it's really important for people to pay attention to that and to pay attention to the long-term implications of COVID-19. We know long COVID is a real thing. I have family members who 16 months out are still dealing with long COVID symptoms. One of Yolanda and my sorority sisters, probably as healthy, if not healthier than us. She's running like 10 miles. She's eating miles for breakfast. Never had a health issue before. She was battling hypertension for almost a year. after having navigated through COVID. And so that's the conversation we have to pay attention to. We know what COVID does. We know the long-term implications of COVID. What we also know is that there is no evidence to support long-term consequences from any vaccine since we stopped using live polio.
Thank you so much, Dr. Yola, that I think that everyone is filled with that answer. But if someone has a follow-up question, by all means add now, or we will go to our next question. Thank you again, Dr. Yola. So this question comes from Michelle. Can those who have not been vaccinated spread COVID to those who have been vaccinated? Anyone can take that one.
I think
Sure,
that,
I'll take that one.
go ahead.
Yeah, this is Dr. Gracia. So I think the first thing we need to understand is the purpose of the vaccine. So the vaccine is not to prevent you from getting COVID. The vaccine is to prevent serious effects, hospitalization, and death from COVID. So you being vaccinated, you still have to use the sanitary precautions. You still have to cover you out on the mask, and you still have to social distance because the disease is out there. It's the same thing if we get the flu vaccine. Oftentimes, once we get the flu vaccine, we still can get symptoms of the flu. So what the vaccine is intended to do, I think, has been misrepresented. And I think that that's the issue that gives us some pause when patients are asking, well, I don't need the vaccine if I'm going to get COVID anyways. So you can still get COVID, you just won't end up in the hospital, or you won't end up with serious complications of COVID.
If I could just echo that excellent response, I think it helps if people know that when these vaccines were studied in clinical trials, prevention of infection is not what they measured. That would have been very costly because that means all the people that they enrolled, and they enrolled tens of thousands of people. That means they would have to screen those people, every week, doing PCR to see if they got infected and all of that, to see if it reduced infection. That's not what they measured. What they measured in one of the studies were the development of symptoms. They develop, or other people develop symptomatic disease, and it provided very high protection. Another study measured hospitalizations. Does it prevent hospitalizations? It did that at a very high level. It should also be emphasized that even with these breakthrough infections, that these vaccines protect against death. They very strongly protect against death. The latest data that I've seen here in the US, that the individuals who are dying from the Delta variant of COVID, more than 99% of those individuals are unvaccinated. Now that can change. And it probably varies from state to state, or whether you're looking at an elderly population or a younger population, but 99%, keep that number in mind, tell that to your friends who are hesitant, 99% of those who die are unvaccinated. It's very strong protection, even against the Delta variant.
I think that transitions into what I was going to share next. In last month's roundtable, I shared that we lost a loved one to COVID-19. Her name, Katina Patrice Jones. In the docuseries that complements this work, we share the story of Tina, putting faces to the rising number of new cases and total deaths. So we were able to share a few moments with Katina's brother, Corey. And I would like to share some of those moments with you now. You can drop that out for the moment. Yeah, thank you. So I'd like to share a few moments of the story of Tina with you, if you will indulge me for.
First and foremost, her name is Katina Patrice Jones. She was 49 years old when she was, impacted by COVID-19. She was a elementary school teacher for 24 years. So she just had a passion for her students, a passion for education, and just a passion for people and putting smiles on faces. Hands down, the funniest person I know. She could light up a room like no other. And there's plenty of stories to prove that. But deep down inside, she had an amazing spirit. Like I can't say it enough. She loved her family, but definitely that comedic spirit and that love that she had for family will definitely be cherished, missed. But I got a strong belief that she's still here. Maybe not physically, but that spirit is still alive and moving in everyone she touched. So I know she's here. Around July 1st, July 2nd, she was diagnosed, went in, tested positive. They didn't take her in at that moment. But on July 6th, that's when there was a shift. I made the phone call to the ambulance to pick her up. She stayed in the hospital until she passed, which is August 10th. So she was in there about a month and 4 days. So she went in on July 4th and she passed away on August 10th at 1:46 p.m. So you couldn't really have long conversations and you didn't want to, right? So our last communication was on the 10th of July. And that's when they put her on the ventilator after that day. So there was no longer any communication as far as that was concerned. While I was actually cleaning up her place after she had passed, one of the things I found in her home was an actual appointment set up for July. Actually it was set up for June 15th. I take that back. It was set up for June 15th to get her first shot. Tina wasn't necessarily against vaccinations. I think like a lot of people, she was on the fence about the severity of going to get it right now. So in all honesty, I really believe that eventually she would have, went and got the shot. But I think she just, for whatever reason, did not make it an extreme priority at that time to get the shot. But in all honesty, I think she would be proud of how her legacy and how her situation could impact someone that's still alive, that's still here to make a decision. I think if anything comes out of her passing, what should come out of it is it's important to take every day and make your health a priority in every day, at every moment. Already, we've had people that have come to us and said, because of what happened with Tina, your sister, I'm going to get the shot, or I have gone to get the shot. So if her passing contributed to someone's life being saved, then her death isn't in vain. My family and I would like to be an example so that other individuals don't have to live this same nightmare, where their Katina Jones from their family is no longer here. I would much rather my sister here with me. But I understand that wasn't the plan. So the only thing that I can do is make sure that her name is not forgotten. We started a scholarship at Dillard High School in Fort Lauderdale. And through their alumni association, we established the Katina Patrice Jones Scholarship Fund through Dillard High School. What we want to do is we want to offer students that are going to attend the HBCU, an historically Black college and university. We want to offer them a scholarship if they're taking up their major is going to be in education. And we are hoping to continue in her legacy and maybe have the next young lady taking up that profession and helping out students get an understanding of why education is so important.
Thank you so much for your indulgence. Again, we put faces to these rising number of cases and total deaths. Corey Jones is actually here with us this evening. Thank you for joining us, Corey. And again, thank you for being vulnerable and sharing with us the story of Tina. May her life not be in vain. We are thinking of you and the Jones family and are encouraged to continue our mission to save lives from dying of COVID-19 as seen in the video. Team, if you can drop the hashtag, which is DHS alum, that's the Cash App hashtag DHSALUM. If you drop that in the chat, if there is anyone that wants to contribute to that, the Katina Jones Scholarship Fund, please feel free to do so. That actually leads me to Dr. Erica Dudley, because we have so many families that have lost loved ones to COVID-19. So how do you help families like the Joneses who've lost loved ones to COVID?
Yes, thank you. And yes, and it's good that you do stories like this to put a face and a family behind the stories, because people just see numbers, but they need to understand that these numbers represent people. And us as a community surrounding the family, just as you do in normal times of grieving, but now it's on a large scale. And the healing process can be a little harder now because you're triggered every time you turn on the TV and there's new numbers and there's new information and people spreading their opinions about COVID-19 and vaccinations. It's hard for them to heal during this time in peace because there's so many triggers for them. So for us, we treat it as we always treat grief and mourning in a mental health setting. But I think it's important for the community at large to note that, there are millions of Americans. So you think of the 600,000 plus people who have died, and they all have family members. And these are people that are grieving and they're hurting in the midst of this pandemic and the other stressors that are around. And so I think it's important for us to pause and think that we're all hurting. The people who definitely have lost loved ones and continue to deal with this pandemic, and us in the medical field who continue to fight this pandemic every day and in our professional lives and our personal lives. So I think it's good for us to participate in things such as this, and like the Jones family being proactive and paying it forward and understand that people's lives do have a purpose, and that with the Katina Jones legacy, the alumni, like starting a scholarship like that can be helpful, and it's part of their healing process, and it's part of our healing process. So I think it's just for us to be mindful, for people to understand that there is help out there. So anyone who's listening, if you feel like, that you are feeling depressed, that you're not functioning as you have in the past, that there is help out there. There are crisis lines that you can call. There's a national crisis line that you can call for suicide prevention. You can also call here in Broward County, and I'm sure in the areas that you live in, a number like 211 to find out information about resources in your area. So I think that's important to know where to go to find help. So you have your community mental health centers, you have national crisis lines that you can call, and you have friends and family that you can speak to. So talk to someone, and if you see someone who you notice a change in, speak to them. So this is a time for us to come together and, and just support each other in any way we can.
I just wanted to, thank you so much. I wanted to mention 2 resources because I do think, as you were saying, stories are so important. So actually, Dr. Yolanda Lewis-Regland has authored 2 books and is at 2 volumes, and she's going to have a 3rd. And it's about the triple pandemic, sort of navigating it from the standpoint of frontline clinicians, but really it's frontline everybody. Very powerful stories. And then my friend, Pastor Deborah Webb from Temple of Praise in Washington, D.C., authored a book, Dark Shadows, My Journey with COVID. So I think, these testimonies are so powerful. And I just want to thank the Jones family because, anyway, I'm not going to start crying, but thank you.
Yes, thank you, Dr. Gigi. And yes, please share, Dr. Yolanda Lewis-Ragland.
No, this is actually a perfect transition. I think that as Dr. Dudley said, so many of us are experiencing this pandemic together. And as I look at this screen, so many of us have these shared experiences just by nature of being a part of communities and communities of color. And so one of the things that we experienced and that we wrote about in the Navigating a Triple Pandemic book was really the intersection of all that we experienced watching the activities unfold before us. Everyone was quarantined at home and watched George Floyd and Breonna Taylor and Ahmaud Arbery. We all watched these things together, and it was very traumatic for each one of us, and for different reasons in various ways. So for us, the triple pandemic was first just experiencing racism in America sort of all together on steroids because we watched this before our eyes play out. That second pandemic is the disparities in health that of course was also being just sort of burst wide open. Many of us were already sort of talking about this, but these were buzzwords for so many other people, and they didn't really see the connection between these disparities. And then the inception when COVID hit, to watch that because of these structural racism and these racist activities here, having the disparities, and then the COVID-19 virus, we were obviously more susceptible. And so our communities were overburdened. And so we're all here probably having had some sort of personal experience with COVID, if not with our patients, with a family member. And so I think community is extremely important. And so I really appreciate that we're talking about this together, and we're finding solutions together. And I so appreciate the Jones family for giving us this living example, and especially knowing that she probably would have taken the shot. One of our authors, William Dash, actually, he's a pediatrician who he's a double amputee below the knees. And he was stricken with meningitis while in medical school. This is prior to it being mandated. This is prior to that particular vaccine being a mandated vaccine. This was in my lifetime. This happened in 1997. He lost both legs below the knees. This did not become a CDC recommendation until 1995, but it was just rolling out. So these are things that are still happening. We're still finding out that being able to take a shot could save lives, save your limbs, save you from going into the hospital. And so this is very important that we continue to have this conversation. So I appreciate all of what we've talked about, but definitely to the Jones family, thank you so much for being transparent and sharing that story with us.
Thank you so much, Dr. Yolanda Lewis-Ragland, Dr. Gigi, and Dr. Dudley for sharing. I see in the chat that some have asked that you put those resources in the chat. So if you wouldn't mind, please, all of those resources referenced, if you will drop those in so that we can take advantage and benefit from them. Appreciate that. Again, thank you, Corey, for sharing and being vulnerable. And once the story is complete, and let me pause and just acknowledge the co-producer of this docuseries, which is Marlon Olivier. I think he is here in the room. If you want, take your mic off and your camera on and wave to everyone. But Dr. Marlon Olivier helped produce this piece, and we did so within 24 hours. We really wanted to share a bit of this story with you. Once it is complete, it will be available on our site. It was also directed by Lisa Arundel, who is an actor, director, thespian, and coach. I don't think she can be with us this evening because she's actually working on set at this time, but thank you, Lisa, for your contributions to this work. Thank you again, Corey, and I appreciate all of you for your reception to his story being told. So I think we will move on to our next question. If you want to drop that next question in, we have a question from Ray. What are the long-term neurological effects? Anyone can take that question. Anyone want to jump in on that one?
I'll just say really quickly. I think that Dr. Gigi sort of laid that out originally as we were talking about this, right? That as we're still getting information from as like the hurricane, what we know now, it's all rolling out. We're still we're still looking for what these long-term effects, but right now we don't have evidence that there are any long-term neurological effects. What we know is they're not long-term neurological effects of COVID, of the actual virus, but not of the vaccine. And I'm wondering, are they asking, because I don't understand if that question is asking about the virus long-term neurological effects or about the vaccine, because the only question just states neurological effects. Well, there is no evidence that there are long-term neurological effects of the actual vaccine.
Well, yeah, not of the vaccine, but the long COVID. And so I think it's really important to understand that with long COVID, and because this virus is so sinister, it's not just a regular respiratory virus, although it certainly has an impact on the respiratory system. It can affect all systems. It can affect all systems. I heard one of our pediatricians talking about the myocarditis and the other types. So it can affect all systems. And long COVID affects all systems. So people who, I think it was Dr. Gigi or someone who talked about a friend or a colleague who used to run, used to be a jogger and could run. And then, you get shortness of breath from COVID and you're severely restricted. And then after the infection's over, here you are 7-8 months and still having those symptoms. And so long COVID is real. And it manifests in all different types of ways. The gastrointestinal symptoms, cardiovascular. Some people have rheumatologic symptoms. So for the audience, that would be diseases that look like lupus, symptoms of inflammatory, autoimmune diseases. Now, the question is about neurological symptoms. One of the things that many people report from this long COVID is this brain fog, meaning it's hard to process information. It's hard to think. And maybe our Dr. Dudley, our psychiatrist, might want to talk some about that. But you have these psychiatric symptoms, anxiety, disorders and things of that sort that didn't exist before the onset of COVID. But the brain fog, these would be what we call cognitive deficits, where you just can't think or process information the way that you used to. We also saw, and I don't know how much of this is long COVID, but it's certainly neurologic, where people would have seizures, people would have strokes and would have many strokes. And one of the things that we learned about this virus is that it causes a lot of clots. We call these in medicine microthrombi, and some of these clots can get into the brain. And so when unfortunately we would look at people who were deceased, and you look in the brain, you would see, you know, all of these clots, and so we started having to treat individuals who have COVID infection with classes of drugs that we call anticoagulants and you know, fibrinolytic and all these other types of drugs that prevent this clotting. But those can lead to neurologic symptoms like stroke or seizure. But again, that's more with the acute infection. Long term, we're thinking more mental capacity and mental functioning. And I'll just stop and see if anybody wants to add anything to that.
Actually, in the interest of time, if we may take one more question before we do an official close. We usually have an after party, if you will, but we do want to give the grace to those that need to leave us at 8 o'clock. If you'll put up the last question, if you will, for the official meeting. So Diana asks, is it safe for everybody? Or are there some people that shouldn't take the vaccine? I think some of you have already answered this question. If you want to chime in with a quick response, then we'll go to the next question, because I think we can fit 2 in within a minute or so. Anyone want to take that one real quick?
I'm going to take it only because I want to just put in a little plug for pregnant women. A lot of time people are asking that question about pregnancy being not safe, a time to be vaccinated. And I just want to make it very clear that the Society for Maternal Fetal Medicine, American College of OBGYN, the CDC have all said it's safe in pregnancy and lactation to be vaccinated. And in fact, pregnant women are at a higher risk of death, a higher risk of hospitalization, a higher risk of loss of their fetus if they are not vaccinated. So I just want to put that plug in so people are very clear that there's no issues with fertility, that we do have a registry for all pregnant women that we encourage to have vaccination. It's called Be Safe. And after vaccination, any complications that occur are reported to this registry so that we can keep track if there's any problems. Now, I have some physicians tell patients that they would not like them to be vaccinated. That's very unusual. It's typically those with rheumatologic disorders, immune disorders. I would have the internist comment more on that. But that's the only people that I have had referred to me that have been recommended against vaccination. And even those, I'm not particularly clear on why they are recommended against the vaccination. So there's another question to add to that question.
I would just say with the Johnson & Johnson vaccine, when in the early trials, there were a category of individuals who had a specific and rare, again, going back to these clotting issues, but they had a rare defect. And that seemed to cause some adverse outcomes in some of the individuals who got that particular vaccine. Again, it was very rare. And has not seemed to occur very, very frequently. Individuals who are on certain types of medications, say, for example, if you had an organ transplant and you're on medications to keep you from rejecting an organ, that's not going to affect the safety of the vaccine. You're not at risk for harm, but you may not respond to the vaccine as well. So there are groups of individuals that don't respond to the vaccine as well because they're getting something that interferes with the immune system. And I'll just stop there.
No, I appreciate all of you and all of your contributions and everyone from the community for submitting your questions. So for those of you who have to leave, we understand and so appreciate your time. For those who can stay, we will answer a few more questions until about 8:15. So let's consider this the official close. If you or someone you know has a story to share, and some of you have already said such, as a survivor of COVID, or you're a family of loss like the Joneses, perhaps even experienced inequities in care, as we've mentioned during this call, we do want to hear from you. Please click on the Share Your Story tab, which is found on our site, flipthescript.online. The Ingenuity team, I think, will drop that in the chat, and someone from our team will be in contact with you. Furthermore, we already have a date for next month. So if you want to pre-register for our next roundtable, which is scheduled for Wednesday, October 27th at 7 p.m., panelists, I welcome you back with open arms. I hope that you got value as much as we have received from you and are willing to return. That registration link has also just been dropped in the chat. So as an official close, I'd just like to say my sincerest thank you for participating in tonight's roundtable conversation. We hope your questions were answered, your fears resolved, and you feel empowered to make more informed decisions regarding COVID-19. Perhaps with a national effort and more grassroots efforts like ours, we truly can get over the hurdle that is the coronavirus. To the Flip the Script production team, Minister Patrick Tyson streaming live from gospelshowcaselive.com, the Ingenuity Promotions team, our valued community, and the panelists bringing your invaluable expertise to this space, there is no Flip the Script without you. So thank you.